Hi guys, good morning. Well, I don't know if it's morning for you, but it's morning for me. So I just did my pre-anesthesia. I don't even know what it's technically called. It's like, basically all it is like a physical, which I think my biggest question was why I had to do this pre-anesthesia thing, because I've been put under anesthesia before for the egg retrieval. I thought it was like a similar procedure. So I'm having a polypectomy, a polyp removed, and apparently they use a like heavier dose of anesthesia when they do this. And just saying that makes me kind of want to throw up a little bit because I hate being put under anesthesia. The egg retrieval was the only other time that I've been put under anesthesia, and I guess that's more of like a twilight or like a lighter dose of anesthesia. So now I have to have this polyp removed. So I went in for the hysteroscopy. I don't know if it's a hysteroscopy or a hysteroscopy. I don't know what it's called. Something like that. And I'm driving right now, if you didn't know. I'm being very safe. But they found a polyp, a very small polyp. She said it should be a very quick procedure. They want to remove it just because, you know, they don't want to, if we're spending all this money to do IVF again, they want us to have the best chance possible. And she thinks that it could possibly be where the baby might want to implant. So I'm having this done in about 3 weeks. So I had to go have this pre-anesthesia workup done. Alright, so now I have to go to work, so I'm like trying to figure out like what is going to be the best way for me to get to work from this doctor's office. But basically all they did for this pre-anesthesia thing, which I don't know if it's something that any of you have had to have done before, but it's just very similar to a physical. They ask you 100 questions, they take your blood pressure, they basically just take all your vitals, and that's basically it. She like went through pre-procedure protocol or whatever, you know, and can't eat 12 hours before the surgery. They actually don't even call me like the day. They call me the day before the surgery to tell me what time I have to go in, which is absolutely ridiculous because, you know, I have a 1-year-old now, so to find someone just like at the spur of the moment to watch her like in a day's notice is crazy, but it is what it is. I mean, I guess I'll just find someone for that whole day and we'll see. She said I'll probably be at the hospital for like 4 hours. Like, what? So apparently it's nothing like the egg retrieval like I thought it was. But I've heard of like some people having polyps removed during their egg retrieval. So this is like totally stressing me out. But I just wanted to fill you guys in and let you know what the pre-anesthesia thing was all about. Yeah. So I needed a physical anyway, so I guess it worked out for me, but I don't know if I should turn here. Should I turn here? I'll go this way? I guess I will. I like have no idea which way to go to get to work right now. The only other thing they did was take my blood as well because I have anemia, so they wanted to see what my blood count was at. The last time I had my blood done was after I had my little girl, and it was extremely low then, and they hadn't done it again since, so it should have come up since then, hopefully. But I do have anemia regardless, so they wanted to just see what my blood level was at the moment. So yeah, that was it. That was all they did. I guess I'll talk to you guys later. Have a great day. Bye.